Plasma cell dyscrasias, including multiple myeloma and Waldenstrom's macroglobulinemia, are usually seen in older patients, usually above the age of 65 or 70. But sometimes they can be seen in younger patients, and like the patient who I have here in the clinic, he's about 45 years old, and he developed back pain about a year ago. But this wasn't taken much notice of, because just prior to that he had a fall of a horse, and so therefore it was thought that the back pain was probably related to his injury because of the fall. But nevertheless, over the last 6 months, he developed increasing back pain and some ankle swelling. He went to a local doctor, and the doctor found that he had a high creatinine of 2 milligrams, and along with that, there was some protein in the urine. Uh, he was referred for a kidney biopsy, and the kidney biopsy could not have been done because he had one small kidney. The DTPA scan showed that the left kidney was smaller than the right kidney. But both the kidneys were otherwise functioning. There wasn't any evidence of obstruction, and so therefore the kidney biopsy was deferred. But subsequent investigations revealed on serum electrophoresis that he actually had a band, which was a gamma band, apart from albumin, and then he was diagnosed as having free kappa light chains in his urine, in his blood, which was 227. His 24-hour urinary proteins was 928 milligrams, with a total protein count of 9.9. So the total protein count was high, which was 9.9. So he was producing excess proteins, and the 24-hour urinary protein was 927. A bone marrow biopsy confirmed the presence of myeloma cells, and he was commenced on chemotherapy. A skeletal survey was done, and the skeletal survey did not show any definite sclerotic lesion. And the important thing was that in the absence of definite sclerotic lesions, he did not have hypercalcemia. Hypercalcemia is usually one of the findings, an earlier findings in patients with multiple myeloma. When the chemotherapy was started, the creatinine was 2, and the chemotherapy consisted of a specific anti-cancer drug, which was given on a weekly basis, and dexamethasone, which was also given on a weekly basis. The creatinine rose from 2 to a current high level of 4.1. He remains normotensive. He does not have any ankle swelling. Physical examination is unremarkable. He is not anemic. He is not hypercalcemic. So the question arises, why does he have impaired renal function um, before and after starting the chemotherapy? Multiple myeloma, as the diagnosis is, causes renal failure by a few methods. One of them is by hypercalcemia and dehydration and the sheer calcium load. Second one is because of hypovolemia otherwise. The third one is because of the myeloma proteins, and the myeloma proteins can get lodged inside the kidneys, and then they can cause nephrotic syndrome, and thereby, after nephrotic syndrome, the person can actually go into renal failure. But not only that, they also cause interstitial nephritis as well. And the fourth one is amyloidosis, which usually is a later feature in multiple myeloma. In this particular gentleman, as I said, he does not have any sclerotic lesions. He's not hypercalcemic, but nevertheless, he's obviously getting worsening of his renal functions since the chemotherapy was started. So therefore, the chemotherapy obviously has a role to play. And we know that chemotherapy causes tumor lysis syndrome, which means that the constituents of the intracellular compartment, which are phosphates and which are potassium, and then urate as a byproduct of purine metabolism, they are produced in excess, and they can cause in their own right renal failure. So therefore, hyperuricemia, hyperphosphatemia can cause renal failure in their own right once chemotherapy is started. He does not have any high phosphate levels. He does not have any high uric acid levels. and he's not hyperkalemic. So therefore, he is not in tumor lysis. And as you've just seen, he's sitting comfortably. So very likely there's an element of hypovolemia and dehydration, which we know that goes along with multiple myeloma. And this is going to be the strategy that he's going to be very well hydrated now, as well as around his chemotherapy. And perhaps we can probably address his chemotherapy, keeping in view his renal function. So, in summary, multiple myeloma can present at any age, and any person who comes with proteinuria and unexplained renal impairment should be investigated for possible multiple myeloma. Doing light chains in his urine, in patient's urine, or checking for plasma electrophoresis for abnormal band in the gamma region is something which should be done in cases of unexplained renal failure and proteinuria. Thank you.